Hi all, today's topic of discussion is understanding special trays in prosthodontics. Welcome to this presentation on the significance of special tray in prosthodontics. Special tray is otherwise called as custom tray. Now moving on to the introduction of special trays. What are special trays? Special trays are custom-made dental devices used to capture accurate impressions of the patient's oral structures. The material used to make special tray can be either metallic or non-metallic. Under metallic, cast metal is used. Under non-metallic, it can be divided into two, the thermoplastic material and the resin. Under thermoplastic material, shellac base plate and impression compound is used. Under resin, cold cure, heat cure and light cure resin is used. Classification of special trays. There are two types of special trays. One is the close fit tray where you directly adapt the special tray without any wax spacer. Another is the tray with spacer and stoppers. These trays use spacer and stopper to provide space for the impression material. When to use special trays? Special trays are indicated in cases involving complex anatomical situations, extreme undercuts, or when maximum accuracy is crucial. Advantages of using a special tray is it offers benefits such as improved accuracy, enhanced patient comfort, and a precise fit for prosthetic devices. Before going into how to fabricate a special tray, let's see the criteria for the fabrication of special tray. The impression tray must not impinge upon the movable structures. The border must be underextended, approximately 2 mm. The posterior limits of impression tray should be slightly overextended to ensure inclusion of the posterior detail for development of the post-dam area in the upper tray. The tray should be rigid and sufficient thickness that it will not fracture during its use. The tray must have a handle for manipulation and the handle must not interfere with the functional movement of the oral structure. The tray must be smooth on its exposed surfaces and should have no sharp corner or edges which could injure the patient. Moving on to the techniques of fabrication. When a resin-based material is used, there are two methods that can be used for fabricating the special tray. One is the sprinkle-on technique and another is the dove technique. Moving on to the steps in fabrication of a special tray. First is your cast preparation, wherein you draw three lines. One is your sulcus line. Second is your special tray line, which is shorter than your sulcus line, about 2 mm. And then comes your spacer line, which is shorter than your special tray line, about 2 mm. Then you move on to placing your relief wax over the relief areas. Then you take a large chunk of wax and soften it, apply it and adapt it over the cast preparation area. Then fourth step is to cut out the spacer and the tissue stoppers. After which you apply a separating medium over the cast surfaces, and then fifth procedure is fabrication of your special tray using cold cure resin. After which you place the handle and then you trim the entire special tray for 2 mm short of the sulcus. Handle fabrication. The criteria of a handle is it should be parallel to the long axis of the teeth. It should be around 3 to 4 mm thick and 8 mm long and 8 mm high. The vertical distance from the sulcus to the handle is 2 centimeters. The handle upstand must be made long enough for the handle to exit through the oral cavity. When it comes to the maxilla, you place the handle about 45 degrees, and when it comes to the mandible, it should be straight. What is the function of the handle? Handle helps in supporting the lip while making the impression. Tray handles are particularly helpful when loading, placing, orienting the custom tray in the mouth. Functions of the finger rest: it stabilizes tray in the mouth, equally distributes the pressure, reduces the pressure applied to the tissues. To sum up, special trays are key players in achieving precision in prosthodontics. Understanding the type, materials and fabrication process equips us to deliver optimal patient care. Thank you for exploring the world of special trays with us today.